Let's look at quantitative pathologies, where we see changes in intensity of sensation. With hypoesthesia, we're dealing with pathologically increased sensory thresholds. Therefore, perceptions of sensations are going to be diminished. This can be generalized, meaning that it affects multiple sensory modalities, or it can be specific, like tactesthesia, or decreased intensity of tactile sensations, or thermesthesia, decreased sensitivity to changes of temperature. Hypoesthesia can be caused by somatic disorders, such as infections, neurological conditions, and so on, or it can be psychogenic, accompanying conditions like anxiety, trauma, depression, and other affective states. We can also see hypoesthesia with somatoform disorder and conversion disorder. Differentiating somatic and psychogenic hypoesthesia can be somewhat tricky. Let's take anesthesia of a palm of a hand to illustrate this distinction. If it has somatic cause, for example, if nerve tissue is damaged locally, we'll see specific localization of anesthesia in accordance to nerve innervation. However, if we're dealing with conversion disorder, anesthetized location will not correspond to nerve innervation, but will represent the preconception of what a person considers their hand. That's exactly how symptom of gloves and socks manifests in conversion disorder, where a person loses sensations in their hands or feet. Again, this does not reflect nerve innervation, but a preconception of what a hand or foot is for a person. Conversion disorder itself is a type of somatoform condition, and we also call it a functional neurological disorder. In the past, we called it hysteria. With conversion disorder, psychological stress or conflict is compensated and finds an outlet as somatic symptoms. It can manifest as analgesia, anesthesia, paresis, non-epileptic seizures, convulsions, and so on. With hyperesthesia, we're dealing with lowering of sensory thresholds. Therefore, stimuli are going to be experienced as more intense. It can again be generalized or modality specific, like hyperacusis, where sounds become deafening, hyperalgesia, where threshold of pain is decreased, or hyperosmia, where sense of smell is intensified. We can see this condition with somatic disorders, such as neurological damage, infections of different kinds, and so on, or it can again be psychogenic. It can present with anxiety, depression, conversion disorder, and it also can represent asthenic syndrome. Since we mentioned it, we might as well describe it a little. Asthenic syndrome is a state of chronic pathological fatigue, exhaustion, and reduced functionality that does not resolve with rest. It can be caused by prolonged mental or physical stress, including chronic infections, anemia, endocrine disorders, and so on.